Nice to meet you. Nice to meet you.
Have a seat. Good morning, everyone. My name is Wong Yijie. I'm the hiring manager of the Asian Integrated Medical Sustainable Arts.
Nice to meet you. My name is Natasha, and I'm part of the HR and clinical operation team.
So first of all, can you each of you briefly introduce yourself?
Okay, so I will start first. Hi, my name is Lo Eun Yi. You can call me Eun Yi. I'm a licensed TCM practitioner with 3 years of experience in providing various treatments such as acupuncture, tuina, herbal therapy, and more. I graduated from Xiamen University, Malaysia in 2022, and then I work as a TCM practitioner with my senior. I've treated many diseases these years, especially in internal medicine and gynecology. And I'm passionate about helping my patients to relieve their pain through holistic TCM approaches. In addition to my clinical work, I also manage a social media account to explain some TCM knowledge to the public so that more people can know about TCM. And then I'm happy to share that this account has gained a lot of followers so far. So I'm excited about the opportunities to bring both my clinical skills and my patient to your clinic. Thank you.
Hi, I'm Chong Yi. I graduated from INTI International University in 2021, and I am a licensed TCM practitioner. Over the past 4 years, I have treated a variety of cases in general internal medicine, pain management, and women's health. So I'm passionate about integrating evidence-based traditional Chinese medicine with modern clinical practice to develop patient-centered care. So outside from work, I also enjoy attending seminars and sharing TCM knowledge through community talks. So I look forward to contributing my clinical experience and enthusiasm to your clinic. Thank you.
My name is Chang Jing. I've just graduated from mid school, so I don't have any experience, but I'm very passionate about being the medical practitioner in your company. Good to see you.
Okay, now can you describe a recent complex case and how do you manage it?
One complex case I remember is a skeptical patient visit our clinic due to his chronic shoulder pain, where he already had multiple visits to other clinics but no relief. At that point, we knew that this patient is skeptical, so we were difficult to convince him about our treatment plans. So I collaborated with my teams to provide a holistic, patient-centered, and evidence-based treatment plans. And then I also explained the expected treatment outcome to him. And then after several treatment sessions, his pain has improved and began his trust. As a result, he referred more people to our clinic. At that point, I knew that the key to earning his trust is integrating both individualized treatment plans with clear communication and follow-up. Thank you.
What about you?
One of the most challenging cases I managed was a middle-aged patient with chronic migraine and poor sleep quality. So after a thorough syndrome differentiation and patient history review, I customized an acupuncture plan and also prescribed a modified herbal formula. I also advised dietary adjustment and stress management techniques. So within 1 month, the patient reported that his syndrome is about 70 to 80% improved. So I think this case show how well-planned and integrative approach and also consistent patient education can make a real difference.
For me, I haven't any complex case yet, but I always treat myself well and always have good outcomes.
Right.
Okay, so let's ask you guys another question. What would you do if you found out that you gave a patient the wrong care?
There was once when I mistakenly prescribed a herbal formula with a dosage that exceeded the recommended amount. As soon as I realized it, I immediately informed my supervisor and the patients about the mistakes. I also explained the possible effects and assured to the patient that we would monitor them closely. I then adjusted the prescription and recorded the incidents according to clinical protocol. As a result, the patient remained safe with no adverse effects, and then I learned to double check every prescription every time.
I would immediately inform my supervisor and the patient, and then take the corrective action and document the incident, and also reflect on it to prevent recurrence. Yeah, for me, patient safety is always come first.
How about you, Mitchell?
For me, I will always use ChatGPT because it always have a lot of information and even correct my mistakes.
Okay, now's the question. Describe a time you deal with a difficult and non-compliant patients.
When I deal with the pediatric patients, we know that many of them refuse to take Chinese herbal medicine because of the taste or fear. So I remember one case where a young boy kept crying and wouldn't cooperate. I stay patient, talk to him gently, and then I gave him some small gifts as the rewards so that he will trust me. And then I also communicate with the patient's parents and help them when they found difficult to let their child consume the Chinese herbal medicine. As a result, this young boy are willing to follow the treatment, and then his recovery went smoothly. At the time, I think that the key is the patients and good communication between both parents and the child.
Okay, how about you?
In my previous role as a TCM practitioner in Tongren Clinic, I had a hypertensive patient that kept ignoring lifestyle advice. So I changed my approach by asking his habits, preference, and worries. From there, we worked out small and realistic change he could commit to, so which gradually improved his compliance.
How about you, sir?
As I said earlier, I haven't treated any patients, but I always find myself a difficult person to treat.
Alright.
Can you give me a specific example of your teamwork skills in a multidisciplinary care team?
So I believe a good team start with clear communication and mutual respect. In one case, I was responsible for prescribing the herbs, while my colleagues responsible for providing the acupuncture to a patient which he had the chronic back pain. Initially, we had slightly different ideas about the treatment focus. So we discussed together about his symptoms and the progress. So we end up with a combined plan. As a result, this patient recovery faster than expected, and this reminded me how open discussion and collaboration can lead to a better care. Thank you.
Alright, so
I value open and clear communication on patient progress and treatment goals. I always respect other professionals' opinion and work towards a shared patient care outcome. For example, in my previous working experience, I work with a clinical assistant and other practitioners. We share responsibilities and discuss cases, and also support each other to ensure a smooth and high quality patient care.
how about you, sir?
I mean, I just graduated from mid school, so I haven't had a chance to work with multidisciplinary team. But I'm willing to work with them, the nurses, the specialists, the medical residents, as long as they do things right. But honestly, I would like to do things my own.
Alright, that's all from us. Do you have any question for us?
Yes, may I know what kind of training and career progression opportunities provided in here?
Good question. We're offering a range of training opportunities depending on the roles. For entry level positions, we provide on-the-job trainings and mentorships from experienced staff. For those pursuing a clinical path, we support continuing education, certificate programs, and occasionally sponsor relevant workshops. As you gain experience, there are opportunities to take on more responsibility and move into specialized areas and supervisory roles.
Could you share what a typical working day here is like?
It depends on the position, but generally our days start with reviewing the patient's schedule and preparing for appointments. Throughout the day, you assist with the patient's intake, support procedures, and updated medical records, and as well as collaborating with the nurses and the doctors. Teamwork is key. Some days are faster than the others, especially during peak hour, but we aim to have a supportive environment even on days that are busy. How about you?
I don't have any questions. Thank you.
Alright, I guess we can end this. So thank you so much for coming. Thank you for the time and thank you for your questions. We'll get back to you after we finalize our decision, and take care. All the best.
Thank you.
Thank you. Thank you.
Alright.
Thank you.
Alright.
Thank you. Thank you.
Thank you.
Bye.
Bye.